I was like in my worst state ever, just like destroyed vagina.
I am horrified.
Like crying from pain, and I was just like, thank you for watching my videos.
Hey y'all, welcome back. Mama Dr. Jones, OBGYN, and Mom 24. Today is a super exciting day. I have been waiting for this day for so long, and you have been asking for this day for just as long. Colleen Ballinger on the MDJ channel, here to talk about her pregnancy and birth experience. If you're not familiar with her, which I'm not sure how you found me and don't know who she is, but Colleen Ballinger is a YouTuber who has been around for a really long time. She is also an actress and a Broadway star. I'm gonna stop blabbering on and introduce her. Colleen, thank you for being here.
I feel so bad. I know that you've been trying to do this for so long. It just took me forever to like set it up, so I apologize.
Don't apologize. I would love to hear what your experience was in pregnancy and maybe how that has affected you moving forward, what your family planning plans were, how that has changed it, things like that.
Well, my pregnancy was, I like to use the word traumatic because I feel that it was. I had a really, really hard pregnancy, and it was painful physically, basically the whole time, and mentally, emotionally. I didn't realize during my pregnancy, but after I gave birth, I realized that I was depressed during my pregnancy, which I didn't know was a thing. You always hear about postpartum depression. And so I just didn't think that you could be depressed when you are pregnant. So I just didn't know that that was a thing. So I was struggling with that pretty terribly. And also the physical pain was really, really intense. When I gave birth, I was like, okay, I don't think I could handle that again, pregnancy again. And I still feel that way. I have a 2-year-old almost, and I still feel like I don't know that I could survive another pregnancy, but it devastates me because I desperately want more children. I enjoyed my birth experience. I love being a mom more than anything in the world. So the fact that my pregnancy was so difficult is really a challenge. It's something I've cried about a lot, like inner turmoil of like, oh, I really want more kids. And of course, adoption is an option, and that's a big part of my family. So I'd love to do that, but the idea that like pregnancy was so hard for me and that's just like not really an option. I mean, maybe it is, you never know, but like it was really, really painful.
What were your expectations going into pregnancy? I see it all across the spectrum. I see people who dread pregnancy from the moment they want to have a baby to people who are so excited to be pregnant. Where were you on that spectrum going into it?
I've always wanted to be a mom, and I was always really excited to be pregnant. My expectations were really, really high, and I think that was part of my just disappointment with pregnancy. I thought pregnancy was gonna be amazing. I had heard of all the things everyone hears about. You get morning sickness, and sometimes you feel the baby kick, and contractions will hurt, and you get uncomfortable and big at the end. Like I'd heard all the typical things that generically everyone kind of knows and kind of like floats over, but I didn't know to the extent of like how hard it could be. And I think something that's important for everyone to know is that every woman is so different. I've never met another woman who had the same experiences as me, and I don't know any 2 moms who've had the same pregnancy experience. And I think that's really important to know going into pregnancy, because I just thought pregnancies were kind of generically the same-ish. Like some people might have had harder pregnancies than others, but in my mind, they were all just kind of like, yeah, pregnancy's kind of hard, but it's so cute, and you have a bump and you get a baby. So like, who cares? So I think maybe if I got pregnancy again, I would have such horrendous expectations that maybe I might enjoy it more. Who knows? But now my expectations of pregnancy are, it's the worst thing ever. Everyone's different. One of my close friends is pregnant right now, and she's nearing the end of her first trimester, and she's just had a little bit of nausea and nothing really else. And I think it's amazing that women can have that. And so I wish that for every woman, but that was not the experience that I had.
You made some really great points, and one of them being that it's different for everyone. And I would kind of counter that with, and none of this should be to convince you like you should get pregnant again. That is such a personal decision, and you're the only one who knows like what that experience was like for you, how it affected your physical and mental health and what the best thing is for you. And there's people who are just blindsided, kind of like you're describing, where they had this kind of romanticized view of pregnancy, and then they get into it and they're like, man, you know, every day something's new. I'm peeing on myself, my back hurts, my pubic bone hurts, the baby's, you know, all these things. And it can be really difficult. And I think normalizing that like you are is really important. A lot of people have the experience you have where they're so excited to be a mom. I had that as well, that I thought when I'm pregnant for the first time, it's going to be beautiful and wonderful. And some of it is, but some of it's definitely not. So if you're comfortable, do you mind going into a little bit of detail about kind of what surprised you, what pain you had, what kind of went on?
Where do I begin? The first trimester, I mean, I was just really nauseous 24/7. It was not morning sickness for me. It was all the time, all day, all night, all morning. I was always nauseous, and I didn't vomit a bunch my first trimester. Like a lot of women, I almost wish I could vomit because I felt like if I could throw up, then maybe I would feel better. Extremely exhausted all of the time. In my first trimester, I feel like that might have been the easiest trimester. And I had heard the first trimester is really hard, and then the second trimester is pretty great, and then the third trimester is hard again, is what I had heard. So I just thought, okay, I just got to get through this first trimester, and then I'll be okay. And my second trimester was horrible. Right at the start of my second trimester, I started vomiting and fainting all the time, almost every day. Like, it was bad, to the point where I was touring because I was working the whole time I was pregnant, and I was on a flight, and it happened while I was on a flight. We were taking off, and I started fainting and vomiting, and I ended up on the floor of the airplane as we were taking off. They had to stop the plane, escort me off. It was very embarrassing, but it happened everywhere all the time. And that was kind of the remainder of my pregnancy. That happened a lot of fainting.
You're describing is something I struggle with treating in my clinic as well, kind of positional hypotension, where your blood pressure gets low depending on how you're sitting or standing, or lying on your back is one of the exacerbating factors. I suspect you got very little help in that regard from your doctor. I can remember 3 patients in my now almost 7 years of practicing just OBGYN that have had this so significantly that it really made them miserable in their pregnancy, and I felt so helpless. What you're describing is exactly what they described of, it ruined my pregnancy. I couldn't predict it, although I knew immediately when it was going to happen that it would happen, you know, and I would get EKGs and echoes, and we'd check blood sugars and we'd check blood pressures, and although we couldn't figure out anything that would help.
Yeah, we went through all of that, and we didn't really know ever what the cause was of all of the fainting, but it was often. And also in my second trimester, pretty early on, I started having really extreme pelvic pain. The pelvic girdle pain. I started feeling that extreme, like excruciating, can't walk pain in my pelvic area in the second trimester, and it lasted the whole time. The only thing that gave me a little bit of a relief was I'd see a chiropractor at least 3 times a week, and he would adjust me and teach me exercises and stretches I could do at home, all of which were painful but did help the pain for a little bit, but it would always come back. Most days I couldn't walk. I was in a wheelchair for a little while. It was really painful.
So was it more like, was it your whole pelvis or centered kind of in the front at your pubic bone?
Yeah, definitely pubic bone. Like, it felt like being stabbed and punched by a heavy, sturdy boot right in my lady bits is like what it felt like. It was extreme pain, but just right, centered right there. And I talked to my OB about it, and he was just like, oh, you know, that happens, it's common. Which I think this aided to my depression and disappointment in myself, was I just kept getting told that's very common. And so I just felt weak. I felt like, oh, why can't I handle this? And I see all these pregnant women everywhere who are walking and who are fine. So what's wrong with me? That, like, am I just really weak and can't handle pain because this is normal? This is how everyone feels. That just made me feel so horrible about myself that I was so, I mean, I can't even express how painful it was. It was awful.
I I hate that you were made to feel that way, because although aches and pains in pregnancy are very common, I would venture to say that it is not normal to be miserable for the entirety of your pregnancy. Was it worse, like if you were sitting down and you got up to walk, did it get worse as soon as you started walking, and it was bad when you rolled over in bed?
Really sleeping was near impossible. Going from side to side in bed was like scream out loud painful in my pelvic area, and walking was very painful. I mean, I'm not gonna lie, I had days where I was okay. Like it was painful, but I could walk and I could get around.
And I'm sure that from what I know of you as a very independent person, it was very hard, if you're anything like me, to ask for help. I always want to do everything by myself, and I'm sure that that can contribute to how you're feeling as well. You know, I'm obviously not here to diagnose things in any way, but just to give some education to the audience. What you're describing sounds a lot like something called symphysis pubic dysfunction, or SPD. Although I see it sometimes, I did not until I experienced it in my own second pregnancy with my third baby, know how significantly that can interfere with your life. If that's what you had and it started early on, you should feel fully validated that, one, that's not something you caused, and two, it's a very unpredictable complication of pregnancy that, although not threatening to you or the baby, is very much something that has a high potential to interfere with your life and happiness, because it affects almost every movement you make. And it's almost like a grinding, horrible, like your bones feel like they don't have any cushion on each other anymore.
Yeah, exactly.
When I talk to other doctors about it, they don't quite get it. And I know why, because I didn't get it either after learning about it in a book until I had it. You shouldn't feel like that was you just not tolerating pregnancy. Those are not normal aches and pains of pregnancy. They may not be abnormal as in dangerous or, something was missed. I would definitely not say that, but it's not a typical experience.
I had a horrible time breathing, allergies, not like my lungs were being crushed, which that did feel like that was happening as well.
Almost like your mucous membranes feel swollen, is that kind of what you mean?
Yes, like could not breathe out of my nose. So it felt like the worst allergy attack in the whole world, but it never went away. Difficulty
breathing is related to elevated levels of estrogen and progesterone, which cause swelling of mucous membranes and makes them more sensitive. And that actually is a pretty common one, but I'm sure with everything else that you were having going on, that was just kind of icing on the cake. Like, okay, I can't, stand up or lay on my back, and now I can't breathe and I can't move because it hurts. Like these are just, they stack on top of each other.
It's just like everything on top of everything. But the other big one that happened was I was, due in 4 weeks, and I started getting really, really itchy on the palms of my hands and feet. Like, felt like if you gave me a knife and said you can cut off your skin, I would have, to get underneath the skin. Like I've never felt itching like that in my life. It was like I was digging. So I got tested for cholestasis. You know more about it than I would, but what I learned about it is that it was like my liver was leaking bile or something into my bloodstream, and it can be really, really potentially dangerous for the baby. Then I was like, well, then we have to get this baby out. And my doctor was like, no, we'll wait and see. And I said, well, how do I know if he's okay? And he said, well, if he stops moving. And so that's what I was told. Like, if your baby stops moving, then you should, then something's wrong. And so it was traumatizing knowing like there's something wrong with me and my liver's doing this and there's nothing I can do about it. So then I was just a disaster.
Cholestasis, or intrahepatic cholestasis of pregnancy, which is exactly what you described, where the bile acids, which are typically made in the liver, are put into the bloodstream in higher amounts. And you had exactly the classic symptoms of that, which is people come in and they say, my soles of my feet and my palms of my hands itch like crazy. It's worse at night. I can't sleep. Then you're not sleeping. So on top of that, you're tired, which makes it difficult to deal with physical symptoms anyway when you're just trying to stay awake through the day, especially when you're working like you are. I want to continue to reiterate that you mentioned at the beginning that it felt guilty, like why are other people able to tolerate this and I'm not? Other people don't always have this many things that are bad. And even though none of these except the cholestasis are, severe pregnancy complications that can be threatening to your baby, tiny things like that add up and mentally are very difficult and physically to deal with. And then on top of that, when your doctor can't give you answers, this is one of the most frustrating things for me as a physician, and I tend to take a very kind of patient-centered approach where I want to spend a lot of time with my patients and hear my patients and listen to them. And I know everybody kind of has a different style, but it keeps me up at night when I have things like this that I can't figure out, and I know my patient is at home miserable and I can't help them. And that's why I continue to, push for, we need more research, we need more information, we need to figure out how to better improve these experiences for people because it matters.
During the whole pregnancy, I just never felt validated, and I was always told, well, that's common, you're fine. And so it made me feel really weak and down about myself, and like there's something wrong with me.
Being validated in what you're experiencing and being verbally told by someone who is in charge of taking care of you that not only is your experience valid, but it's okay if you hate this, you don't have to love it, and that won't make you a terrible mother, can go a really long way for someone. Do not get me wrong, I have many, many wonderful OBGYN colleagues who are male and great. Like, I think they can be excellent as well, and your doctor probably is excellent as well. But I feel like I do have a little bit of a unique experience because not only am I a female, but I've had kids the entire time I've been an OBGYN. My twins were born when I was a medical student, and I've had that perspective, and I figured out early on that it's so important to listen to your patients.
Yeah, and being someone who is really open about my experiences online throughout this whole process, pregnancy and birth and motherhood and postpartum and everything, I've always been very open and vocal about it. Emotionally and physically, I've talked about everything, and through that I've noticed a lot of moms being grateful that I'm talking about the hard stuff, but also it's a really sensitive subject, so it's also difficult to talk about because I don't want to be insensitive to the women who can't get pregnant and wish they could. And that was also another struggle for me, is feeling really guilty that I wasn't enjoying it because there's so many women who wish they could experience it. And I'm so grateful, as miserable as it was, I am so grateful I was able to get pregnant and have, my baby and experience that. Like, even though it was miserable and I don't wish my experience on anyone or on myself ever again, I am so grateful I got to do it. And so there's like a balance there that I never wanted to make it seem like I wasn't grateful. I think it's important for pregnant women to know you can be grateful that you're pregnant and also be miserable, and that's okay. And it's okay to not think this isn't the magical, beautiful, ponies and rainbows experience I was expecting. Like, it's okay to be like, oh, this kind of sucks. And I'm grateful that I'm having it and that I get to experience this, but it sucks. I think that's important for women to know that that's okay.
And to see you on this side of it where it sucked, but you're still a wonderful mom. It doesn't invalidate anything that you experience in the pregnancy, and now you can still look back on it and go, yeah, it sucked, but here's where we are, and that's important too.
Totally. And I had the opposite experience of what I was told and what I expected, which was pregnancy would be fine and birth would be the worst, most traumatizing thing I've ever heard of. My birth wasn't, and my birth was, I liked it. It was hard for sure, and birth is, a crazy thing that your body goes through, and it's really intense. But I enjoyed my birth experience, and it was nothing compared to my pregnancy. I would take birth over pregnancy 1,000,000 times over.
And that's a unique view for a lot of people as well.
Oh, I know. It's very unique. It's not common, but that is my experience.
It's beautiful. I love that too, because a lot of people are very afraid of birth. And I think I even heard you mention maybe in one of your videos that you were really scared of the delivery process. I think it's also really important for those stories to be out there, because a lot of times all we see are these very polarized birth stories of it was either, this beautiful home birth with nobody there and everything went fine, or I had a very traumatic hospital birth and everybody was, abusing me, which, don't get me wrong, I know that these things happen in our hospitals, and I am, one of the people trying to make a difference in that. But I also love that you bring that up because it's important for people to see a non-scary hospital labor and delivery experience as well.
I think it's really important for anyone who wants to be pregnant or who is pregnant to know that, like I said earlier, all women are so different, not just physically and how you're going to react physically, but mentally and emotionally. Every woman is so different. Every human is so different in how they will react to things. I knew for me, I did not want a home birth because I knew for me, I really trust doctors and I wanted to be there in case something went wrong. My pregnancy was so awful that I thought there's no way this is going to be an easy, beautiful home birth. I also at that point thought, well, I obviously can't handle pain well because look at me compared to all these pregnant women. I'm gonna need help with pain because, you know, that's just was my impression. And so I knew I needed to have a hospital birth and I was scared that it would be miserable. I was pleasantly surprised when I got there to find out that it wasn't. I had wonderful nurses and my doctor was great in that experience.
I think you mentioned in your birth vlog that you got an epidural and that you were really happy that you did that. Can you talk just a little bit about why you felt like that was the right choice for you and how it helped you as far as, or didn't help you, whatever your perspective is, as far as like enjoying the birth process?
I know that for me, I took the necessary birth classes prior and those actually gave me panic attacks. So some women need to know all of the information and really understand exactly what their body is doing and why it's doing it and how the pain's going to be and how they can manage the pain, and that's really helpful information for them to know and important information for them to know. For me, it just made me panic and freak out to hear all the options of what could happen, how it could go wrong, how I should react, and how my, you know, all those things freaked me out because I just thought of every worst case scenario and thought, what if my body can't do this? And I had panic attacks. So then I went into my birth going, I'm going to trust my doctors. They've studied this and they went to school for this. They know more than I do about this. No matter how much I study in the next few months, they went to school for years. They know more than I do and I trust them. And I decided I trusted them and I went into it knowing I need to trust them, that they have my best interest in heart and they want to keep me and my baby safe. And I'd rather just do that than go in and tell them that I know better than them because I knew that I didn't. And everyone's different, but that was my experience and I knew I just panicked when the more information I learned.
How you explain that is almost exactly how I talk about it with my patients. It's like planning a wedding. You can plan as much or as little as you want. You can get as much help or as little help as you want, but don't try to plan things that we can't control. Don't try to plan the weather. That sets people up sometimes for disappointment when they try to plan every little thing that are sometimes out of our control. I think that what you touch on is really important because we're kind of told like you have to go to birth classes, you have to learn everything, you have to find out all your options. And that's a really important thing for some people. Some people want to do that. They want to make every single decision. And some people want to be pregnant and go to the hospital and have a team that they have a lot of trust in and come home with a baby. And that's an okay thing as well. And I try to kind of explain that to patients. You are the only person who knows your level of anxiety and if it improves with tons of information, or if once you have that information, you worry about all the possibilities. And so I'm glad that you brought that up.
There's a lot of like, you should or you have to talk with motherhood and with pregnancy and birth. And I don't think that's ever accurate unless it's like an emergency situation. So I went in and my water broke and I went in, I think I was 2 centimeters when I got there. And they wanted me to progress a little bit faster because after an hour I hadn't progressed, but my water had broken and they knew I had cholestasis and all that. So they said, you know, we'd like to give you Pitocin. And so I think first they gave me like a shot of a painkiller because the contractions were extremely painful even though it was only 2 centimeters. And so they gave me a shot of some painkiller that I don't remember what it was.
Probably something like fentanyl or Stadol, especially if it kind of made you feel loopy a little bit.
So they gave me that and it made me feel a little bit loopy and tired, and I wanted to be awake and aware. So when they came in and said they wanted to give me Pitocin, what do you want to do? I was scared of getting the epidural because the first drug they gave me made me a little bit loopy and out of it. That's what I thought the epidural was going to do, so I said no to the epidural at first. And they gave me Pitocin and it got really painful. And my contractions got really, really painful, and I was progressing fast. And so they came in and they heard me kind of like moaning, and they came in, they're like, did you want the epidural now? No pressure. They were really sweet about it. And getting the epidural, I've always heard is really terrifying and painful, and it wasn't for me. I mean, it's painful because there's, you know, putting a needle in your spine, but it wasn't as bad as I thought it was gonna be compared to how bad my contractions were. I didn't really care. And then I felt great. I had a great epidural experience. You know, I wasn't really in too much pain. I could feel enough. I could feel the baby moving. I could feel him going down and getting closer to where he needed to be. And I could feel contractions, but I wasn't in agony. And you know, I feel like the perfect experience with the epidural. I progressed faster because I wasn't as like tense and freaking out. I was just really relaxed. I was able to take a nap. So for me, the epidural experience was really wonderful. I pushed him out in like 20 minutes, and I think maybe total of 6 or 7 like pushing times or whatever, you know, contractions and pushings. And he came out and I tore a lot. And so the recovery was really bad. I've always heard, you can tell me here, but that the epidural, since you don't feel, sorry, my computer, since you don't feel too much with the epidural, then you push and you're not gonna stop if you feel the ripping or tearing or whatever, and so you're pushing harder and fast.
That is a really common thing that people say, and we've studied it a lot, and people don't actually have, if you look at a global population scale of people, worse tears if they get an epidural. But you do tend to have worse tears with your first pregnancy. Where do you think you are as far as the trauma that you experienced in pregnancy and healing from that physically and especially mentally? How are you coping with that?
It's been hard just because all my friends that had babies at the same time as me now already have another baby or are pregnant. And I wish I'm like, weren't they so miserable? How could they want more? But I guess that's, you know, I'm like, that's what people do. A lot of people do that. And so it's a struggle because I'm feeling the natural like urges and yearning for another baby and for my son to have a sibling. And for me, I love being a mom. It's incredible. And so I want more kids so desperately. So it's really difficult, you know, having that like conflict in my mind of like, oh, should I do it again? Because some moms say their second pregnancy is easier. Some moms say it's worse. Some moms say it's the same. Again, every woman is different. So there's no way to know what would happen to me if I got pregnant again. It could happen. I don't know. And if it does, I'll be excited to like take that journey and see where it goes. You know, it's mentally, I think a lot of people say, oh, you just forget. That's what I always heard, is you forget about all this pain and you forget about the birth and you forget about the pregnancy pains and you just want another one. And I do just want another one, but I have not forgotten. I mean, you can't forget like a year of your life that was the most miserable, painful year of your life, physically, emotionally, mentally. I mean, there's no way to erase that. If it happens, it happens, and I will go on that journey, and I think I'll be more prepared this time, and I won't be as disappointed because I'll have the expectations of my last pregnancy as opposed to an expectation of pumpkins and rainbows. I don't know why I said pumpkins and rainbows.
That's a new one, but maybe you love pumpkins.
Hey, we love pumpkins, so it's fine. So I think, you know, I'm open to it. We'll see what happens. Physically, I think another thing that a lot of moms don't know is the recovery. I think people just go, oh, you had a baby, yay. And the recovery can be really difficult. And for me, it was a long recovery as well because of how much I tore. I didn't know there was all that stuff you had to do and all the things, you know, going to the bathroom's not just going to the bathroom anymore. There's a lot of items that you have to take with you, and it's like 20 minutes to pee because of all the things that you have to do and cleanse and take care of, and I was not prepared for that. And my recovery was very long because of my situation. I'm fine now physically, but like physically looking not the greatest. So I got like Frankenstein's down there. So that is something I wasn't expecting. And so that's another thing that I think moms should be prepared for. I was not prepared for that experience. Which, funny, a story happened to me right after I gave birth. A doctor came in, a nurse came in to tell me how to clean and take care of that, and how to deal with, you know, cleaning everything and all the blood and everything that's happening, and it was explaining everything. I'm on the toilet and she is down, like showing me, physically showing me how to do everything. And she looks up at me and goes, "I'm a big fan, by the way. I saw you tweet you were in labor and I was hoping I would get you here." So that was mortifying. I was like in my worst state ever, just like destroyed vagina.
That is horrible. Oh my gosh. I am horrified.
Thank you. You know, I'm like crying from pain, and I was just like, thank you for watching my videos.
Oh my God, that is so terrible. I'm sorry on behalf of the medical profession that someone would do that.
I wasn't like mad, I was just embarrassed.
For your birth experience, sometimes you just want it to just be that experience and have people around who are helping, who aren't fangirling while you're trying to recover your perineum after a delivery.
I think I wouldn't have cared if it was like I was in bed holding my baby and she said, "Oh, I love your videos," or, you know, any other scenario would have been fine. But it was like I had just given birth and I had just a million stitches, and she was teaching me how to clean that area, I mean inches from it, and looked up at me as I'm sitting on the toilet, and that was the moment she chose. And I was like, why couldn't you wait 5 minutes till I'm like standing and we're not in this scenario? Like, it was very funny.
That is something else. Well, I think that you touched on something else really important too, is people say, oh, you forget and whatever. And I think that's a really important distinction between the difference between pain and discomfort and actual trauma related to pregnancy or delivery. People forget or can ignore things that were temporarily not enjoyable or temporarily hard or painful. But you don't just forget something that your mind and body have perceived as traumatic. That's because your body and your mind are warning you that this was extremely traumatic. And you don't want to forget those things, and that shouldn't, you know, nobody should make you feel like that's the goal. I try to tell my patients, your job is not to ever forget something that was traumatic. It's to process it, to feel it, to validate the fact that it happened to you and you didn't cause it, and then to work on letting it go where it doesn't interrupt your normal parts of life. And I think there's a big place for kind of cognitive behavioral therapy and things like that in these scenarios, because people are told by society that it should just be okay, and it doesn't have to just be okay.
Yeah, I think if I ever went through it again, I think that I would go into it really asking more people and getting multiple opinions on how to deal with things, because I think I just kind of took it how my doctor said it, was just like, well, it's common and so you're fine, and instead of, you know, maybe getting more opinions from other doctors, other moms who've experienced the same things. I think, you know, that would be my approach the second time around, is expecting it to be difficult and knowing that it's not just, we'll just sit there and deal with it. And, you know, there are things you can do that might help alleviate some of the pain, and I would definitely be in therapy if I went through it again. You know, so there's a lot of things I would do differently. We'll see if it happens. I have no idea what to expect for the future of me and more children.
You know, I mean, and you know this, but it's okay if it doesn't, and it's okay if it doesn't because you don't want it to. You aren't, even if you want to expand your family, you're not obligated to sacrifice yourself mentally or physically to do that. You also matter in that equation. And although, you know, having seen some of your videos and stuff, I fully believe that you are a wonderful mother and that this is your passion in life, just like mine. It's okay if that's not on the table for you. And I think it's important for people to hear that. And that's why I think it's so great, and why I was so drawn to your story and your experience when my subscribers started telling me about it, is because I could tell from, you know, seeing you with your family and your son that this is what you live for. And people need to see that it's okay if that's your priority, but it's still really hard for you to imagine doing it again.
Totally, yeah. So we'll see what happens, but.
I appreciate you sharing your story and hopping on here with me. Do you have any questions for me or anything that you would like me to make sure my followers know about pregnancy or parenting in general?
You know, I'm just really appreciative to hear a doctor validate a woman's feelings and, you know, actually giving information about each thing that I was feeling as opposed to just like that's normal. So I'm very appreciative of you for that and just for educating people in general, because that was something that really shocked me when I started talking about my pregnancy and birth and postpartum. Was a lot of people going like, oh, I didn't know any of this stuff. I didn't know that these things happened. I didn't know that this stuff could happen. I didn't know that this is how women could feel, or and so just to know that there's anyone else out there educating people, because I think women are kind of taught that you just enjoy pregnancy and don't talk about, you know, the difficult stuff. So thank you for just talking about it and being open about it and educating people.
Thank you. Thank you so much, Colleen, for being here today. I wish you the best of luck in everything. If you're not subscribed, hit that subscribe button. Check out Colleen's channels. I have linked them below. Kind to yourself, to each other, to me. In the comments, be kind, and I will see you next time.